all grasp by now after several classes with Dr. Conboy that just provide intervention in the language spoken at home. Don't take that away from the parents, especially when they're in their pre-vocalic. I mean, that's the language they should be receiving speech perception measures in anyway, so there's no point in switching up, to English right after they get cochlear implants. It's just going to mess with them. So here are some more specific articles and details you can look at.
Can I add?
Yes.
So, really critical that this language piece is scattered throughout the whole thing. We have to assess in that language, because think about it, Vietnamese, I don't really know the language, but is one of the tonal languages. So then the child is gonna be perceiving, you gotta look at how that child's perceiving the different tones in that language, right? The different types of sounds in that language, because it's not going to give, if you're just looking at English, it's not going to be giving you a full array of what that child's hearing. And because it is what the child has been receiving for all his life, it is what the child's going to be receiving for the next couple of years. And because they're limited in English, it's crucial that that pre and post treatment or the pre and post assessment continues with that Vietnamese being scattered and included throughout the whole thing.
I have a question. I totally agree that the home language needs to be preserved, but as an English speaking SLP, should we provide our intervention in English so that he's getting 2 language inputs, or should we be working with the parent and just mostly be having the parent making the sounds and stuff?
Okay, I think this is kind of ideal world, like Henriette Langdon, oh, you're not supposed to be giving, that, whatever. Okay, so there is an article that says, SLP's responsibility is to develop at least minimal phrasal competence, and that's not really ideal for any of us, So yeah. I think when we talk about it, we can quote this and say that is what is expected. In reality, what does happen is beyond our control. If we're given this child, are we going to say, no, I can't provide therapy? I don't know. So I think that's how you interpret it, and safest thing is to quote this and say, in the perfect world, we would have minimal competence phrase, but who can do that with all?
Yeah, I know my tonal wouldn't be.
Right, yeah.
Well, that you want to make sure that you use an interpreter, use someone for that language, because, and again, this question doesn't ask about treatment. This question asks about evaluation assessment.
Yeah. Okay,
but
cool.
If it branches over to treatment, then you have responses for how you should do it. But you should have an interpreter. The ideal world situation is what they want to hear, because they want to know that you guys are going to be doing best practice when you guys go out there. And so that's what you guys can present it at. But assessment, if you can't do it, then you need to have an interpreter doing that assessment and helping you out, who's trained, and you got to do all that with an interpreter, because that is the piece that has to go with all the different components we talked about.
Thanks.
And I think that's why the parent interview evaluations are also really important, like the PEACH and the IT maze. So you probably might want to go through them and see if there's any questions that could be biased towards one culture or another, but then you can just state that in your assessment.
I have a quick question and a question that I don't know if it matters that much. Did you say if all the assessments that you were giving were also available in Vietnamese language?
No, they're speech perception tests, so it's just seeing if they can detect sound.
What about the parent interview?
That's what we would have to say, we would have to have an interpreter, and then we would have to filter out questions that weren't appropriate to that culture, and that would be done through the interpreter who could tell us the cultural norms.
Okay, because I feel like when I was reading stuff long time ago, they might have said that they were available in Vietnamese, but I just couldn't remember which ones.
Okay, I'll look into it.
I couldn't find any. I think the IT maze, there's a couple languages. I saw there was German.
Yeah, I might too.
Which one has
Peach,
bear on
actually,
it?
Yeah.
is in Vietnamese when we were first talking about it.
Which
The
one?
peach.
Oh, it is.
So then I would say that those would bump up on your list of the ones, the battery to give. Those would bump up, and the ones that you have to tweak and change would be lower. But you still might want to do it for support depending on how much depth they go into. Because one of the things is that one of the problems with a lot of the different assessments when you're looking at production, like the vocalizations, is that they have different definitions for what that vocalization is and different age of emergences. So that's why it was recommended to have multiple, because the saved R takes all that into control. But we also wanted to include the other ones because the saved R, I don't even know if that one has, I don't take acoustical information, so I don't know. So it might not be needing to be compared into a language because it takes the acoustical information. But I can look into that.
My other thing was, I feel like Dr. Conboy is like prone to ask a question about. Oh, well then I don't even know what to say. But like cultural sensitivity and differences in like the Vietnamese view on treatment and speech in general, and like how we as SLPs would be culturally sensitive to that, and like I know in a treatment with a hearing impaired child, you really have to direct the parents, and like is there a cultural difference between the way that Vietnamese culture views that versus us? Do you think, I don't know if anybody thinks that's like
I think I understand what you're asking, and considering that the focus of this question is about hearing impairment and auditory rehabilitation, there are things that we can control of, but we can't necessarily know all of the different cultural sensitivities we need to take into account for each of our cultural populations. So I think it's going back to saying, that's a good question. I would refer to ASHA or any other medical books about cultural differences, kind of like what we did in her class. So I think there's just a blanket statement you say there, well, that's a really good question. I'd refer at that point in time, if I were to do treatment, I would look at these books.
Okay.
Just blanket statement.
I came up with this question, then I had to Google it because I didn't know if it was a dumb question, but my question was kind of like, do cochlear implants, like, would they suffer from having a lot of input from a tonal language because they are so like, there's that article we read about that woman who like could hear and then couldn't hear, she got cochlear implants, and she said it sounded a lot more robotic. So I Googled it, like, do cochlear implants work in tonal languages? And this woman said that there's a way that cochlear implants can be fine-tuned for speakers of tonal languages. So that might want to be something we could throw in there, like look into fine-tuning cochlear implants for tonal languages, because it does need to have that like extra level of like precision. I don't know. Yeah, I thought at first it was a dumb question, and then it said it was a maybe. So
is that a PDF?
It's actually just an article that I found.
Can you upload it to the question number 4?
Yeah.
And that's totally up to the audiologist because they're the ones who would be working with the cochlear implant. But that would be a good consideration to have when considering the factors of the cochlear implant. But if there's something that controls it, then it's fine. It wouldn't be that much of a factor.
Unless it's like a huge your tonal language, we have to do it this way.
Right.
Then I feel like that would be worth mentioning. But I think overall it's just sensitivity to culture and understanding that it has this big, and I think like the after perception test will really help us also see if the child is able to perceive the tonal differences still.
Yeah.
And so if not, then I feel like that's a good article. It'll be like, from there, then we'd go back and present this problem. But
That would be crazy. That sounds cool to like check. Anyway, yeah, neat.
okay, cool. So I think we're out of time. Any last questions?